Welcome to another one of our Dr. Foot videos. Firstly, it's really cold outside. I don't do good with this cold weather. I really struggle, so I am all layered up and I'm drinking more coffees than usual, which is not a good thing, which means I can't sleep at night. But I'm not here to talk about my sleeping habits. I'm here to talk about a subject which I'm very passionate about, something that I find really interesting. So I'm talking about exercise-induced lower leg pain, commonly referred to as shin splints. And the reason why I'm talking about this is I had a patient in yesterday who was referred to me from a chiropractor. So came to me with a letter in hand, and the letter said this patient has shin splints, he has flat feet, and I think he's getting shin splints because of his flat feet, and I think you should make him some insoles and that will stop his shin splints. So I read the letter and I thought, you what? That's not really a diagnosis, and that's not the reason why you get shin splints. So there are 40 plus different conditions that can affect the lower leg while doing an exercise. 40 plus, and they're all managed completely differently. Some people need surgery, some people need hospitalization, others just need an injection, others need rest, others need to be managed in completely different ways. So it really depends upon the individual diagnosis. Now, shin splints, very much like the term metatarsalgia, which also riles me up, which just means pain in the ball of the foot. Shin splint basically just means pain in the lower leg. It's not a diagnosis. Now, before I talk about what I did with that patient, I'm going to talk about a couple of the most common causes of exercise-induced leg pain. I'm not going to talk about all 40 because you'll get sick of hearing my voice, and I don't have that much time. So a couple of the most common ones. Firstly, one of the most common ones is the condition called medial tibial stress syndrome. Medial tibial stress syndrome is when the patient has pain on the inside of the leg, usually a couple of inches above the foot. The pain usually starts at the beginning of the sport, football, rugby, cricket, tennis, or going on a run, but you can run it off and it gets better after a couple of minutes. However, after you stop that activity, it comes back with a vengeance. It can be quite painful, and it can be painful the next day as well. Now, medial tibial stress syndrome refers to inflammation of the periosteum, which is the thick connective tissue that sits on top of the bone. It's very vascular. There's a lot of nerve endings in there, and the theory states that traction being caused on this periosteum is leading to inflammation. I'm going to talk a little bit about how to treat that later. One of the other conditions that is very common with runners, also happens to soldiers, is a stress fracture of the lower limb. Now, stress fractures, unlike medial tibial stress syndrome, the patient normally refers to a pinpoint location where it hurts. The pain stops as soon as you do as soon as you stop the activity. It can also lead to night pain depending on how bad it is. Medial tibial stress syndrome, the pain is more diffused, over 5 to 7 centimeters. It's quite difficult to palpate, unlike a stress fracture where you can normally point at it. Doesn't get picked up on x-rays very easily. You have to send the patient off for an MRI, and depending on how much damage has been done, you would manage this in different ways. A couple of other conditions that can lead to lower exercise-induced lower leg pain. You can also get entrapment of a nerve. So the perineal nerve can get entrapped, so you'll get discomfort, tingling, sensation, pain on the outside of the leg, which can shoot down into the foot. You can also get cramping there. For some bizarre reason, some medical health professionals also refer to this as shin splints, but it's not. We would treat this completely differently. You can also get entrapment of the popliteal artery, which sits under your calf muscle, so you can also get cramping there. Now, I've talked about some of the causes, but the most common cause I actually haven't even spoken about, which is chronic exertional compartmental syndrome, which I think is the most common cause of exercise-induced leg pain, which is also referred to as shin splints. Now, chronic exertional compartmental syndromes, usually you get it in both legs. Usually you get discomfort and pain, and sometimes cramping, sometimes you'll get numbness in the foot. It will stop as soon as you stop the activity. You can rest it off, and then when you come back to the activity, it may come you will get the discomfort again. We manage this completely differently. There's some special tests that we have to send you off for to find out the kind of pressure you've got in your compartment, in your lower leg, and that is managed very differently to the other conditions. Now, regarding this patient that came to me yesterday, who the chiropractor suspected he had shin splints, he actually had, well, I think he had a stress fracture, because he could refer to a pinpoint location, and I was able to palpate that location and elicit quite a bit of pain. So I've sent him off for an MRI. So I'm going to come, when the MRI results come back in a couple of days, depending on how much damage has been done, we will manage his symptoms and manage that condition. So we'll have a better idea in the next couple of days on how to manage it, but I've told him just to rest for now and not to do any running. Now, medial tibial stress syndrome. It does respond well to orthotics if we can, and that's because we're offloading pressure from the inside of the leg. It's not because of flat feet. I also like to work on strengthening muscles in the lower limb and the hips to try and offload pressure. I'm always thinking the underlying cause. So is there something in the hips or the knees which is leading to excessive forces being placed upon the inside of the leg? So all that has to be addressed. A couple of other things that we do. Shockwave treatment is really good. I might make a video on shockwave treatment some other time. Shockwave treatment, we do shockwave on the lower limb, and that increases the chance of healing because localized blood vessels come to the area and they repair the periosteum that's damaged. So you have a shockwave session every week for 3 weeks, and it works really good. A couple of other things that we can do is a prolotherapy injection, so glucose mixed with local anesthetic. This was really advocated by an awesome podiatrist named Nat Patia, who's in London, and a radiologist named Otto Chan. So they've done thousands of these procedures. We can also do that for you. But as I've said many times, diagnosis is key. You really need to know why you're getting this particular condition. Shin splints is not a diagnosis. Don't go onto Google and think I have shin splints. Go and visit a health professional. When I get my words out, go and visit a health professional, a physiotherapist, a podiatrist, a sports doctor, somebody who can be able to assess your lower limb, take a really good history, maybe send you off for other tests, and really be confident in the diagnosis. If it's a stress fracture, we may recommend calcium, vitamin D. There may be other things that we could do regarding your loading patterns and how much training that you're doing. So there's a lot of things that we can work on regarding a lot of different things, including trying to alter your gait or your running style. So there's a lot of different tools we have within our toolbox to treat a wide variety of different lower limb exercise induced leg pain. But as I've said, diagnosis is key. I better go. My next patient is due literally in 3 minutes, and I better finish off my coffee and go get my patient. I hope this video was helpful, and I shall speak to you soon. Take care. Bye.